In this video, we'll discuss about benzodiazepines. So this one is the better version, and comparing to barbiturate, this one is the better version. How many drugs we have? We have many drugs. Some use as hypnotic. Hypnotic means for sleeping. It is used as insomnia. Okay, hypnotic used for insomnia, sleeping disorder. Some used as anti anxiety, and some are used as anti convalescent. So these benzodiazepines used for hypnotic, anti anxiety, and anti convalescent. This one diazepam, see here. Okay, it can used for insomnia, also it can used for anxiety, also in this one used for convalescent also. So everything we are using. What does they do? Okay, what are the drugs? In hypnotic we have diazepam, flurazepam, nitra nitrazepam, then alprazolam, then diazepam, then triazolam. These are the drugs comes under this hypnotic. In anxiety drugs, we are using this same one only, diazepam, then chlordiazepoxide, then azazepam, then lorazepam, then alfrazepam, then anticonvulsant, here diazepam, then lorazepam, clonazepam, and clofazepam. These are the many drugs we are using for hypnotic and anxiety and anticonvulsant. So now what is the mechanism of action? What does they do? They do only thing of a facilitatory action. Okay, so here only kappa facilitatory action, and they do not do kappa mimetic reaction. Okay, this barbiturate will do two function. One is kappa facilitatory reaction and kappa mimetic reaction, but here only one. See this diagram, you see here this one is benzodiazepines. Okay, it will come, it will bind with this receptor. This one okay, it will come and binding with the receptor. Is it does not open chloride channel. Okay, here this one not open chloride channel. They just increase augment action, just increasing augment action. They also record kappa further action. This one also record kappa further action, but in barbiturate without kappa also they can will involved in that mimetic action. Okay, so facilitatory action and mimetic action common in barbiturate, but here only facilitatory reaction. Okay, this one not open that chloride channel, just increasing augment action. They also record kappa further action. So this one is the mechanism. So it will bind with this kappa receptor, then increasing affinity of that kappa receptor. Most frequent opening chloride channel. So here increase. Okay, not duration, kappa facilitatory effect only. So here no mimetic reaction. So chloride enter cell, then it will do hyperpolarization, then inhibition will happen. what are the difference between barbiturate and this benzodiazepines? Mechanism of action, kappa facilitatory action. Here kappa mimetic action. Here only kappa facilitatory reaction only happen. No this no never do this mimetic action. Then this will open, okay, it will increasing the time. Normally 1 millisecond means here 10 millisecond, but itself after that this one increasing the timing, this one only this mimetic action self opening that chloride channel. But here, okay, here also augment that activity of intrinsic kava. Okay, so here facilitatory action only, no mimetic reaction. They never work absence of kava. So what is the meaning here? um, Here this process first step it okay, first step, second step without kava also, this one involved in this reaction. Okay, this mimetic action involved in this process, but here for their acting, okay, these drugs acting compulsory kava should be presented. That reason only this one is unsafe, because not required to activate the receptor, hence not safe. Here without kappa also it can react, that reason only this one unsafe, but here with kappa only it will react, so this one is the most safe one. Okay, since affect depends on release kappa. Then amnesia, here we knows already, here happen. Okay, barbiturate, that patient forgot to take medicine again and again they will take, so here amnesia will happen. Here no amnesia. Then here antidote nil, here we can use antidote. So here that antidote flumazenil there are using available in market. Antidote flumazenil. So this benzodiazepines increase that chlorine condensations. That is, it have only kappa facilitatory, but no kappa mimetic action. But barbiturate have both kappa facilitatory and mimetic action. Next, we want to discuss that uses. So uses we already knows this in insomnia, anxiety, epilepsy, and free anesthetical medication we are using. That one used for only anesthesia, okay, and epilepsy. But this one we are using for anxiety, in insomnia, epilepsy, and free anesthetic medication. Suppose any person taking sleeping dose for suicidal attempt, okay, so that time doctor will ask that parent, okay, they ask that empty bottle. Suppose they will take this, suppose a person tried suicidal attempt, he taken sleeping dose, okay, doctor asking that empty strip. There are showing that barbiturate means worried because they don't have any antidote. If there are showing in this one, this benzodiazepines means doctor will quickly give that flumazenil, okay, flumazenil antidote is available. That is the advantage we are having the antidote. It is having lower abuse liability and it is safer respiratory. Okay, so this one is don't affect respiratory and cardiovascular function. So this one is safe, and comparing to barbiturate, These benzodiazepines have more advantage. In barbiturate, we have mimetic and facilitatory action. This one only facilitatory action, but this one we have antidote. That antidote name is called flumazenil. So in this video, one more sleeping dose benzodiazepines used for insomnia, anxiety, and anticonvulsant drugs. These are the drugs list. Then mechanism of action only increasing affinity, not involving mimetic action. So this one not opening chloride channel, okay, just increasing affinity only, not with the help of kaba only it open that chloride channel. These are the major difference between that barbiturate and these drugs. Anxiety, what are the drugs? Insomnia drugs, epilepsy, then free anesthetic medication. Adverse effect, then advantage. High therapeutic index, don't affect respiratory and cardiovascular, low abuse liability. Then we have antagonist, flumazenil. Thanks for watching.